Welcome, everybody, to our first episode of our new series, Postcards from the Operating Room. Today, I'm so thrilled to be joined by Professor Iskandar from the University of Wisconsin. Dr. Iskandar has served in several national neurosurgical committees and has previously served as the chair of the American Board of Pediatric Neurosurgery, as well as the chair of the AANS Pediatric Neurosurgery section. Most recently, in July of this year, Dr. Iskandar led the extremely successful first ever National Pediatric Hydrocephalus and Endoscopy workshop in Bolivia. This workshop entailed a 2-day course on CSF diversion and endoscopy, using innovative approaches for neurosurgery in a resource-limited setting. So, Dr. Iskandar, welcome to our first ever podcast episode. Before we begin, I wonder if you could talk to us a little bit more about your personal neurosurgical background and specifically your interest and intrigue in global neurosurgery.
Sure. Thank you, Tanya, for the invitation. I'm a professor of pediatric neurosurgery at the University of Wisconsin. I've been in this position for 28 years. I was first recruited to build a pediatric neurosurgery program there, and now the program has 3 faculty, and it's something that I've had a lot of fun building. My background in global neurosurgery is actually short. In 2004, I visited Dr. Benjamin Worf in Uganda when he had just started to develop a program of hydrocephalus endoscopy and spina bifida, which is now world-renowned. And that really gave me a lot of enthusiasm for what global neurosurgery is about. But at the time, I started having a young family, and I decided that I would not pursue global neurosurgery until my family has grown. So in 2019, we started this program that you're talking about.
Perfect. Thank you, Dr. Iskandar. So this workshop in Bolivia, I understand it was the very first of its kind in Bolivia itself. So for our listeners, I wonder if you could share with us a little bit more about the health need in Bolivia, and particularly neurosurgical demand and what patient populations look like over there.
Yes, of course. So the way the program started is Dr. Bob Dempsey, who's the chair of our department and also the chair of FIENS, and I sat down one day and decided that it would be important that our program has a dyad with a lower middle income country or department. And he suggested that we partner with an NGO called Solidarity Bridge, and in particular, the Neurosurgery and Neurology Institute within Solidarity Bridge. I looked it up, and I found that this was an NGO that really fit what I thought an NGO should be doing. It embodied authenticity and service. And we met the leaders of that NGO, Dr. Juan Lorenzo Hinojosa and Richard Moser, and I felt that this was definitely the right decision. And of course, as I worked with their staff over the past few years, it really confirmed that this was the right place for us. Now, why Bolivia? Bolivia is the most impoverished country in South America. It is landlocked. Only a couple of countries are landlocked in South America. But despite of that, it has a diverse array of climates and landscapes because of its spread from the Amazon basin to the height of the Andes. This combination made it both a beautiful country that is very heterogeneous, but it also made it resource poor. This spread specifically to the surgical services. Even though the country has made a lot of effort into improving primary care. Surgical services suffered tremendously. And then we found that that its neurosurgical population is also heterogeneous, although many of them lack the proper training that we have in the US and other countries. Um, uh, some of them do, but they lack the resources to be able to apply the training that they have. And we found that there was a particular difference in care that's provided between the public hospitals and the private hospitals. And in fact, the public hospitals that we've visited, some of them, it's remarkable how little resource they are. The elevator doesn't work. They don't have a microscope in the operating room. So we felt that we could actually serve there and be helpful.
Thank you, Dr. Iskandar. That's very inspiring. And so moving to the actual workshop that took place in Bolivia, could you talk us through a little bit of the timeline? So what did the planning look like? What did the actual workshop look like? And then the other end as well, the reception and how you sort of appraised how well the workshop went.
Yes. So the workshop is part of a bigger program that we've established. The program that we've developed was officially sanctioned by our School of Medicine, University of Wisconsin School of Medicine and Public Health, in collaboration with Solidarity Bridge and its partner in Bolivia, Puente de Solidaridad. And so what this program what we've enumerated in this program is how to develop a stepwise approach to educating the neurosurgical population in Bolivia, starting with the residents, and improving their resources. So the mission that we developed, the primary benefit was to increase neurosurgical knowledge and skill among trained residents and new neurosurgeons. And indirect benefits would be increasing access to safe and minimally invasive neurosurgery, increasing surgical efficiency in the hospital setting, cost savings to residents and resident training programs, especially, increased access to subspecialty training, and potentially later certifications of some sort. And the program was divided into several components. The first component was didactic. Starting in late 2022, we started giving bi-monthly, every other week, talk virtually to all the residents in Bolivia, and in fact, also all the residents in Paraguay. And these talks are very well attended, and they span a plethora of neurosurgical topics, from pediatric to spine to tumor, vascular, epilepsy, functional, and trauma. And these were interspersed with case discussion sessions. A resident in Bolivia or Paraguay will present cases, and one of our faculty would discuss those cases. Second is access to the educational conferences in medicine. Third is observership for residents in Bolivia and Paraguay to come to Madison. So these are paid observerships for 1 month. And fourth is the boot camp. And so we've had 3 boot camps so far, 2 endoscopy and hydrocephalus boot camps and 1 spine boot camp that have been quite successful, and that really, in addition to starting them on training really in minimally invasive techniques, it gave us familiarity with the programs there and with the residents there. More importantly, it gave them familiarity with us. And we started a bit of a mentor-mentee relationship that we're trying to develop now with the various residents there. And what we had decided is that the people who who attend more than 80% of our virtual lectures are the ones who can compete for the observership, the funded observership to come to Madison. And the last component, which is what we're working on now, is program development. Starting with developing an epilepsy program, epilepsy surgery program in Santa Cruz. This is a program that was started by actually Lurie Children's Hospital in Chicago, and we're taking it on and developing it further. We're hoping that we would develop a pediatric spine surgery program, maybe in Cochabamba. So there are various programmatic developments that we have in mind. Now, in terms of the boot camp, which is what you've asked about, the first one that was done is actually a spine boot camp by Dr. Brooks, one of our faculty, and it was very successful. It was done in two departments, two cities in Bolivia. Based on that, we were able to learn some lessons and develop an endoscopy and hydrocephalus program 6 months later in La Paz, Bolivia. That had about 30 attendees, mainly residents and young neurosurgical faculty. It had a theoretical series of lectures, and it had a workshop, hands-on workshop, that included several models to help them practice endoscopy. And then based on the feedback and based on our observations there, it helped us tune up the lectures that we're giving every 2 weeks, tune up future boot camps, and tune up program development.
Thank you. And clearly this has been an extremely successful boot camp, but also wider program in Bolivia. And one thing that I read in the publication of the Bolivian boot camp was this idea of innovation, particularly innovation of high income neurosurgical techniques being put into low income settings, in this case, Bolivia. So Dr. Iskandar, would you be able to share with us maybe some examples of what this innovation looked like in your particular case in Bolivia?
Yes, absolutely. Maybe I should uh, first give you a little bit um, information on what we're doing in Madison and what the spirit of innovation here means and why we want to spread it outside of Madison. So when I came here, you asked me before we started what brought me to Madison and uh, what what I found attractive about this community. Even more important than that, what kept me in Madison. Well, there were two things that I noticed. First, Bob Dempsey's vision that we are there to serve but also innovate because we are dissatisfied with the current methodology that we give for patient care. And if you've ever talked to Dr. Dempsey, he tells you this, and I fully agree with that what we do is just not sufficient. So one of the attractive parts of University of Wisconsin, it's a public university that's one of the best research universities in the country. In fact, when I came in 97, I think it was ranked top 2 or 3 in the country after Johns Hopkins. So innovation lives and breathes here. And it's a public university, which means the word service is implicit in it. And it's based really on a policy in education and research called the Wisconsin Idea. So in 1904, the then University of Wisconsin-Madison president, Charles Van Hise, declared that he would never be content until the beneficent influence of the university reaches every family in the state. So this is not a university confined within its walls, but it really is there to also help people around the state and communities around the state, like they've done with agriculture here. And so we felt that this really resonated well with us in the department, that not only we want to innovate for our patients here, but maybe we should actually spread it to outside the state. And so this idea of innovation, when you go to lower middle income countries, has to do with resources. I can go and teach them as much as I want about our fascinating endoscopies that we do with the fascinating equipment that we use. They can't afford that equipment, right? They can't afford the training models that we use. They can't afford the big laboratory space. So we started innovating just in little ways to try to improve that. And so one of the really neat things that we've done, for example, with our endoscopy courses, is develop a watermelon model um, for endoscopy. So the watermelon has a flesh inside that is very easy to manipulate. And so we cored in ventricles within that flesh. We made burr hole sites. And then we found very cheap uh, and endoscopy equipment online that we bought. And this is the training. This is part of the workshop that we did in Bolivia and then later in Paraguay. I've been so impressed by this model that we started applying it to our own workshops here in Madison, even for U.S. residents. So, things like this, we try to do, and others try to do in similar circumstances, but it would be it wouldn't be wise to think that we're going to teach them what we do here and expect them to apply it. We have to be very respectful of their resources, their culture, their training. Um, and so we're trying very carefully to work on all these issues at the same time.
Wow, and thanks for sharing that example about the watermelons. That was really, really interesting. I wonder if you could talk to us a bit more about how the Bolivian residents received the program at their end, if they had any feedback and what their sort of vision is for the future as well, going off of the boot camp that was conducted there.
Uh, it's actually fascinating. They're thirsty for this. It's obvious that they are in an environment where they don't really have the possibilities that they see on the internet. Nowadays, you're no longer sitting in a dark room. You know exactly what's happening around the world. And when you see what is being done in the US and in Europe and other places, you say, why can't we do it here? And they feel insecure about their training. So I think that when we started going, they saw it like a breath of fresh air, that yes, someone is willing to work with us on establishing the type of infrastructure and care that we've been wanting to do. And they put a lot of effort into it. The residents that have visited us here, there have been two so far, two others coming this year, um, were thirsty for knowledge. They were going from the operating room to the microdissection lab, to the cadaver lab, to the research lab, to the clinics. Um, and it, it it was great to see. And of course, when you really put this effort in young people and trainees and young neurosurgeons, it has way more potential than if you put it in people who are established, who have a lot of expectations and difficulties um, uh, with their long history in their departments.
Yeah, fascinating. And as I say, obviously an extreme success on both ends. But I guess this podcast wouldn't be complete by me asking you, were there any challenges in putting this sort of program into place? And if there were, what would your future recommendations be for your team, but also for other neurosurgeons thinking of setting up similar programs in low resource settings?
Yeah. So, I don't like the word challenges very much. I think I like the word opportunities. there are opportunities everywhere. When I came to Madison, there were opportunities to grow a program that wasn't there before, for example. Every one of us tries to advance one thing or another. So the first thing that I asked myself when I started to really dig into what Bolivia is about is, why do I want to do this? And I really think that before we can really start a program like this, we have to convince ourselves that we're doing it for a really important reason. And so the why is essential. Once you answer the why, once you decide, yes, I'm doing it because I feel that this is really terribly important, then you start looking at what you can improve. What opportunities are there to bring long-lasting improvement into this culture? And so we talked about challenges. We talked about lack of resources. We talked about lack of training. We talk about uh, really um, a country that is a bit ostracized from the higher income countries. Um, there's a lot to do, and the key is to be organized, do it in a stepwise fashion, and try to bring in as many collaborators and resources as you can. Um, so I don't know if that answers your question, but that's how I think about it.
Yeah, that's great. And particularly, I just had a question about communication. So obviously, Bolivia, Spanish-speaking country, your team, I assume, predominantly from the US. How did you go about bridging some of those gaps that are absolutely essential to bridge when it comes to such a course?
Yeah, well, the word bridge is crucial, because the answer to this question is Solidarity Bridge. So Solidarity Bridge is a phenomenal HMO that not only guides you through the politics of the country and makes sure that you're safe there, that you have all the right contacts, all the right letters, but also they provide a team of medical students for translation. So when we go there, we're assigned a couple of medical students who will translate every lecture, will translate every discussion, and they are really phenomenal. So, when you know what you want to do and why you want to do it, then you figure out what resources you need to make sure you get it done. And you're absolutely right. Language is crucial, and uh, there are no better, there's no better system that I've seen than what Solidarity Bridge has. And it's all, of course, um, based on what I told you at the very beginning. It's an NGO that is absolutely authentic in its purpose. They're very targeted in what they try to do. They cover 4 surgical specialties, including neurosurgery. They know exactly what the needs are. They target those needs. Um, so it's been, I mean, the reason for our success is really in large part because of this organization.
Yeah, thank you for sharing that with us. So that brings us to the end of our questions here, Dr. Iskandar. Thank you so much for sharing what has been exceptionally inspiring for all of us listening. I've learned so much, and I'm sure I'm going to take back a little piece of neurosurgery in Bolivia with me. I hope that we see you again in our future podcasts, and I wish you all the very best for your future neurosurgical endeavours. Listeners, I hope that you can join us again for our next podcast, where we take you through an inspiring journey through Ethiopia and spinal surgery. Thank you, Dr. Iskandar.
Thank you very much, Tanya.